thank you. We're excited to kind of hop into how we put this all together with regard to technology and really the age of innovation for dizzy patients. So the first piece that we're going to jump into is virtual reality. So virtual reality is a simulation of 3D images that are computer generated while you're immersed in interactive environments wearing special electronic devices. So in the dizzy space, there are multiple kind of pieces of software that are used now with goggles where patients are able to be exposed to very simple, very repetitive stimuli in a 3D environment. The reason this is really important is because there is a big disconnect between a lot of dizzy patients and what they're able to tolerate from a visual standpoint. And so virtual reality is used in the therapeutic capacity for a lot of patients in order to actually bridge the gap between what we're getting in the real world with regard to lights and speeds and shapes and sounds, and what patients' thresholds are and what they're able to physically tolerate. So don't think of virtual reality in the sense of popping goggles on and just watching different video games or being exposed to like roller coaster rides. There's a very systematic approach to virtual reality when we're talking through the therapeutic application for dizzy patients. So a lot of times the virtual reality is providing a very calming, very simple, very visually understimulating environment so that the patient can very slowly be increased, or their thresholds can very slowly be increased in certain capacities. So what happens a lot of times with virtual reality goggles is patients are able to be exposed to optokinetic stimuli, gaze training, and going through a lot of habituation exercises in a very slow, controlled way at home. So they can sit with their goggles, they can go through the treatment protocols that the clinicians have set up clinically, and then maintain the progress that they're making daily or weekly in the clinic. So it really creates a very simple and a very easy way for patients to use the resources at home. So virtual reality in healthcare in general is used in a lot of different capacities. So kind of speaking globally, in the healthcare industry, VR is being used from everything from robotic surgeries to help surgeons during surgical procedures, to pre-op, helping patients when they're actually sitting there, if there's a lot of anxiety or a lot of angst before they're actually going in for the procedure, during labor and delivery for a lot of patients, and even then getting into just a lot of education for patients. So it's pretty amazing to be able to pause the environment that you're physically in and put on virtual reality and be able to actually immerse yourself in a different environment. So it's exciting for a lot of patients to be able to do that in kind of the global healthcare world. And then in the dizzy space in particular, we're able to siphon that information and make it applicable in a very specific way for our patient population. So what's really important from a dizzy space is how we're actually able to tap into two very specific senses. So a lot of virtual reality, it can expose and kind of engage all five senses, but particularly for dizzy patients, we're looking at the visual and the vestibular systems. And you know now from a lot of the talks that we've done throughout the course of the day, these two systems are very intimately connected to each other. And the virtual reality is just a dynamic visual environment that's going to be able to tap into both of those senses at the same time. And we can use them for rehabilitation and use it very effectively for rehabilitation for patients. So it's simple, it's easy. I think the take home that we really want to help all of you understand is that it shouldn't make you sick. Just because you put on your nephew's VR headset at the holidays or tried a VR headset to watch a movie at a certain point does not mean that that's the experience you should be having in virtual reality rehabilitation. The clinician that you're working with should be able to very systematically expose you to the right stimuli at the correct time to make this simple and palatable and effective. So the second thing that we want to tap into is going to be artificial intelligence. And so really it's just asking a simple question of, can we actually get machines to think for us? And that's really been kind of the point of a lot of scientific minds trying to tap into, can we really simulate human intelligence in machines? And the reason that that's really important is because dizzy patients are kind of bounced around from specialty to specialty. And so is there a specific algorithm that can be used and a very specific process that can be followed to get those patients to the right spot at the right time, or to see the right patient in the right order? And so it's really cool to think about what's happening in healthcare right now with regard to artificial intelligence. So, the goal of artificial intelligence in healthcare really should be to simplify the lives of patients, doctors, and even hospital administrators, to really make tasks easier that we're all kind of doing on a paperwork, standpoint, and a questioning standpoint for patients, but quicker and more efficiently and effectively with less time and at a fraction of the cost. And so that's really where artificial intelligence comes in, and where it's really reinventing and reinvigorating what's happening in modern healthcare. And so if we're able to tap into machines and allow these algorithms to really predict, comprehend, learn, act, do all these things that we need them to do to make the end game easier for patients and make the end game quicker for patients, then it's a win-win on all fronts. So if you think, just kind of as a general rule, that artificial intelligence is machines doing the thinking of humans and taking these large caseloads and taking a lot of the human errors out of the game, that's where a lot of the excitement with AI in healthcare really comes into play. So with that, electronic medical records are going to be a big piece of that puzzle, and how a lot of the data is being siphoned, and then how a lot of the algorithms are being put into play. Because the use of electronic medical records over the last 10 years or so has really allowed us to take patients' history, the diagnosis, any medications, put the treatment plan together, kind of the big picture in one spot. And so it's allowing access to evidence-based tools and letting the clinicians and the providers really make decisions on a global scale. So it's automating the actual provider workflow, but it's helping the patient experience be streamlined. I'm going to read directly from the slide, but the healthcare industry and computing technologies, so taking what we know with healthcare and then the computer technology itself, really is at a final point where these enormous amounts of data that are very complex can be put together and then really evaluated in a very meaningful way. And so the reason that's important, if you keep thinking about the dizzy patient and how we kept talking about how confusing it really is to kind of go from specialty to specialty and from wheelhouse to wheelhouse, it's important to understand that through artificial intelligence and trying to figure out how we cut and shape and put the patient into the right department, and then use the electronic medical records to really kind of look at the patient from a very big global scale, then all of this comes together a lot quicker than it used to. So what is the future of AI and dizziness, and really understanding how we make how we make very confident and very effective decisions. And so using AI as a decision tool to assist in the recommendations and the appointments and the treatment should really help kind of cut out the 5 to 6 to 7 specialists that patients are seeing. And the goal is to allow the fastest time to correct that diagnosis of the patient with the best outcomes. So really the kind of future of all of this, and putting the bricks and mortar of the clinics at the ready of patients, comes with the actual understanding of telehealth. And telehealth is the use of electronic information and telecommunication technologies to extend that care outside of the clinic and into patients' homes, and where the doctors aren't necessarily in the same space at the same time. And so we've talked kind of globally and internationally about the lack of resources for dizzy patients and the dizzy community. And so telehealth is an amazing way that we're able to bridge the gap between bricks and mortar clinics where you're able to go in and physically see a patient physically see a clinician that's close to you versus telehealth where you're able to have access to to have access to doctors and other clinics outside of your city, outside of your state, or even outside of your country. And so this is really exciting because not only from a diagnostic standpoint are you able to tap into different resources and different clinicians, but you're also therapeutically able to access different tools and resources that might not necessarily be right next door to you. So really, whether you're at home or you're at the office with telehealth, you're able to tap into your doctor through video or even phone. And this is important because you can communicate, via phone, via video, via, even email to get the answers that you need in a very intimate way. And so you are able to very effectively and quickly communicate with your clinician that you've built trust with and that you're able to tap into the resources that they're able to provide. So when we start integrating all of this, so how do you take all of this and put it all together? And the simple answer is that working with the right clinicians, they will be able to kind of direct and put these puzzle pieces together for you. And so most clinicians that are working in integrated healthcare systems or working in collaborative environments are very aware of what's already happening in the background. A majority of us are already using a lot of electronic medical records. The majority of us are already using telehealth resources, really tapping into what the artificial intelligence capability is. There are multiple hospitals and different facilities throughout the world that are currently using AI to triage patients and get patients into the right specialty a lot quicker and a lot more effectively. And so the bottom line should be what's happening internally from a healthcare and a provider standpoint should be being translated on the outside. And for the patient, that should just mean ease of use, getting your appointments a lot quicker, getting your information translated a lot faster from your treatment team, and getting the answers that you need a lot quicker too, and a lot more effective and efficiently. So we should be embracing this. We should be excited about this from all facets. Technology is the future, and using it responsibly and efficiently is really how this all comes together for all of us.